And even though the plateau has been reached here in New York, still at a devastating level, we note that in Illinois and Massachusetts and elsewhere, they're still fighting the surge of this virus. And tonight we're with the EMTs in Boston as that state also prepares for the next eventual step. They're using contact tracing. They've hired 1,000 disease detectives, as they're called, to track any new waves of this virus. We've heard a lot about this, so we wondered tonight, how will it actually work? Here's Will Reeve from Boston tonight.
Tonight, Boston in the grips of the pandemic. We're with the first responders working round the clock, fanning out through the city, answering call after call, many of the patients suspected to be sick with COVID-19. EMTs taking every precaution, scrubbing up in layers of PPE.
The patient has been loaded into the ambulance. The EMTs took off their scrubs, disposed of the PPE. Now they're headed to the hospital.
The grueling routine taking a toll on these first responders.
There's no sugarcoating this stuff. We're drained. We are exhausted.
The death toll in Massachusetts nearing 2,000, with hospitals bracing for any surge, the state battling the virus on another front.
We've got to do this right, and we've got to respect the virus. Big time.
Fighting to stop the spread with a critical tool, 1,000 contact tracers who call anyone who's tested positive so they can alert others who came within 6 feet of that person for more than 15 minutes. These so-called disease detectives like Mia Williams in Kentucky are working the phones.
It's like an emotional roller coaster in a way, because what you're trying to do is connect all these cases, and from connecting all of those cases, you're trying to prevent or control spread.
I work for Salt Lake County Health Department.
In Salt Lake County, Utah, tracers have tracked 85% of the known cases there.
Will Reeve with us from Boston tonight. And Will, this contact tracing sounds probably for people at home like an overwhelming undertaking as this country prepares to reopen. So these contact tracers in Massachusetts, they want to find anyone who has had close contact with people who have tested positive?
Yes, David, and that close contact is defined as coming within 6 feet of someone for 15 minutes or more. So anyone who comes into that close contact with someone who has tested positive will be asked to self-isolate. Now, those tracers here, they have a lot ahead of them. This process starts out with phone calls to individuals, and so far in Massachusetts, there have been over 41,000 confirmed cases. David?
Wow. So anyone within 6 feet for 15 minutes or more. Will Reeve, our thanks to you for that report.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.